World marks Clubfoot Day. There has been a call for awareness on treatment for early diagnosis between the ages of 1 to 5. Some of those living with Clubfoot still face some stigma, with others being abandoned by their families. Helen Aura caught up with Bridget Mwarabu, who has managed to overcome the sting around the condition.
Braving through the ups and downs that life has thrown at her, 35-year-old Bridget Mwarabu can now smile as she reflects on her journey, which, she says, has not been relatively smooth. She is one of the many Kenyans living with Clubfoot, also known as talipes, a condition brought about by a shortened Achilles tendon that has caused the foot to turn in and under.
I remember our mistress in primary school, Akaniambe, Bridget, you need to speak yourself a positive words every day in the morning. That you have to wake up in the morning and speak positive things. And if you speak positive things, you will overcome the stress. Ikakuwa routine. I started healing now and I started accepting myself.
The stigma surrounding those with Clubfoot, especially in the African setting, has seen many children either abandoned by their families at birth or left out on the streets, being branded as the cursed children.
I'm the only one in the family that has Clubfoot. I grew up like children were discriminating me. Like playing and everything, they thought these legs of mine can be contagious, like they believe maybe ndambukizana na hawa.
Employment is a mirage for many with disabilities, even as Kenya implemented a bill to help cushion those with disabilities.
The causes are known, but of course there are risk factors, one being that it's a genetic condition. Other risk factors like, when there's very little amniotic fluid, where the baby is in the mother's womb, and of course it's seen in mothers who take some certain types of drugs.
These are some of the types of Clubfoot. Talipes valgus, where the foot points outwards towards the sides. Talipes varus, where the foot turns inwards. Talipes calcaneus, where the foot points upwards with the heel touching down. And talipes equinus, where the foot points downwards. According to data from the Hopkins Medicine, the foot imbalance brought about by Clubfoot may be detected during an ultrasound screening as early as 12 weeks. Still, the treatment plan is established once the baby is born.
Treatment for Clubfoot has three levels. The first level is what we call the Ponseti method. It's applicable to any child who is between the age of 0 to 2. The second level of treatment is a small non-invasive procedure that is done while the baby is on the mother's lap.
One of the key challenges for those living with Clubfoot is the high cost of the special boots they are required to wear.
But kiatu yangu si ati I walk like the way you go to supermarket or Bata and pick your shoes. No, they have to mold using the plaster the shape of my leg, and then wanze kutengeneza kiatu kulingana na miguu, shape ya miguu yangu. Na hii kiatu naweza kuwa napima size na ina take 3 months.
One also has to maintain a balanced weight due to the pressure on the feet.
So mostly naishi nikimeza dawa ya calcium na painkillers kwa sababu ni uchungu, and I cannot trek for long distance, I cannot stand for long distance.
Bridget aims to one day become a voice of change among those living with disabilities. The essential requirements for those living with disabilities has on numerous occasions been emphasized and articulated. For those living with Clubfoot, among the needs required are the special customized boots, which the patient and families say could be availed at low costs, would help many from less privileged families. Helen Aura, NTV.